Hello, my name is Martha Dawson. I am the 13th president of the National Black Nursing Association. I have been a nurse for 43 years. I've enjoyed every aspect of nursing from the bedside to the boardroom. I started out as a young nurse taking care of open heart patients at the University of Alabama in Birmingham. Then I moved into management when I was about age 23. I've done a little bit of everything in management. I've been a nursing director, a chief nursing officer, a chief nurse executive, and VP of clinical affairs, which included not only the nursing department, but also food and nutrition, environmental services, the gift shop, and all other ancillary support services such as respiratory therapy, physical therapy, and the lab. Currently, I am an associate professor at the University of Alabama in Birmingham, where I teach nursing and health systems leadership to graduate students as well as doctoral students. My best and most exciting journey, however, this past July, I was installed as the 13th president of NBNA, and I'm excited about where we're going and what we're going to do.
My name is Esther White. I am a nursing student at FSCJ. I am in the ASN program, and the reason why I want to be a nurse is because I want a job that has purpose. I want to know that I help someone mentally, emotionally, and physically.
My name is Gwendolyn Mathis, and I'm a forensic nurse. Many of you might think of Law and Order Sexual Victims Unit when you think of forensic nursing. Oftentimes, forensic nurses do sexual assault exams, but in my case, I actually use my nursing knowledge and investigative skills to determine whether vulnerable adults have suffered abuse or neglect, and whether they have actually suffered any long-term health care consequences. I look at medical records, I observe clients, I do interviews, I gather several sources of information in order to make my determinations. And also as a forensic nurse, I do end up in law and order because I can end up testifying in court. My name is Gwendolyn Mathis, and I'm a forensic nurse.
Hi, I'm Vanessa Hartwell, and I am a retired Navy nurse. And currently I teach senior nursing students. I work for a company out of Houston. I teach the NCLEX reviews, so I get to go around to a lot of the colleges and universities and meet a lot of nursing students. I teach a 3-day review to get them prepared for their NCLEX examination. And it's very rewarding, especially when I hear from the students as far as how they did on the NCLEX exam. I taught nursing for about 10 years before that at an associate's degree program at St. John's River State College.
Greetings, I'm Adam ONeill Smith. I am a family nurse practitioner, also known as Advanced Practice Registered Nurse here in the state of Florida. Being a nurse is awesome. We are healers, we are advocates, we are educators for our profession. I began my nursing career in undergraduate study at Florida A&M University in Tallahassee, Florida, where I matriculated up to Birmingham, Alabama in my first career as a nurse, working at the University of Alabama in Birmingham Medical Center as a hematology-oncology nurse. While working as a nurse at the bedside, I noticed the importance of primary care and primary prevention from an outpatient setting. My experience working as a bedside nurse is what encouraged me to further my nursing education and pursue a graduate degree with a Master's of Science in Nursing to be a nurse practitioner. In the role of a family nurse practitioner, you really are at the forefront of the healthcare setting and the patient experience. Providing primary care is not only just affording patients with opportunities to provide one-on-one patient education, but it's also an opportunity to really provide holistic care and making sure that we reach health outcomes in the patients that we serve within the community. Nursing is an awesome profession. Nursing is a profession of healing, a profession of giving, and a profession of nurturing, and really meeting patients where they are right at their needs.
Hello, I'm Dr. Janine More. I am a nurse. I am your nurse anesthetist. You will see us in surgery and also in the battlefield. We administer anesthesia to all patients, children, adults, geriatrics. We keep you out of pain so that you can get things fixed, broken bones, unhealthy hearts, unhealthy livers. That's what we do. We are nurses. We are your nurse anesthetist. I am Dr. Janine More.
I am Dr. Carol Jenkins Neal. I am a graduate of Bethune-Cookman University and Barry University. I am the current president of the First Coast Black Nurses Association. I'm a nurse educator. I love to watch new nurses grow and develop into making positive impacts for the patients they take care of. Nurses are collaborators. We must collaborate with the community and community partners in order to be able to increase awareness of chronic diseases and prevention. Nurses are innovators. We must be innovative thinkers in order to be able to think outside of the box in order for change to take place. Nurses are advocators. We must advocate in our community and speak for the voiceless and the underserved populations so that we could be able to go into those communities and make a difference. I am Dr. Carol Jenkins Neal. I am a nurse.
I'm Dr. Barbara Darby, and I have been a nurse since 1970. Graduated from Hunter College in New York in 1970, so that makes me a nurse of 49 years. If I had it to do again, I would not change my career because nursing has been very good to me. I started out as a staff nurse at the Veterans Administration Hospital in New York, where I worked in the surgical intensive care unit, and my primary function there was to take care of patients who had open heart surgery. Boy, has that changed between 1970 and 2019. But I moved on to Jacksonville, Florida, and worked at Baptist Medical Center as a staff nurse in the coronary care intensive care. So by that I'm saying I really liked action nursing. Intensive care nursing is about action. People are very sick. Nurses have to be very well trained and highly skilled and very observant, and so that's the kind of nursing I like to practice. I went on to get a nurse practitioner training and went into family planning and women's health, different side of nursing, and that's the beauty of nursing. It really affords lots of flexibility. So I went from intensive care to family planning and women's health, worked with mothers after they had their babies, telling them about how to keep themselves from having more babies until they were ready, and enjoyed that. But I always wanted to teach nursing. I can remember when I was in my program at Hunter College, looking at one of my professors and saying, I can do that. I can do what she's doing. And that was the beginning of my dream to teach nursing. So when I moved to Jacksonville, I actually met someone by the name of Dr. Lois Gibson, who was the director of the nursing program. Now, mind you, I had a full-time job at Baptist Hospital, but I was told that she was the director of the program and I needed to talk to her. And so I did, and I left my full-time job at Baptist, took a part-time job at then Florida Junior College as a nursing professor, and I taught adult health and maternity nursing. Loved it, enjoyed preparing the next generation of nurses. Did that for 2 years, and then I became a full-time faculty member. So this started in 1979, so in 81 I became a full-time faculty member. Loved working with students. It was the best of both worlds. I could teach and prepare the next generation of nurses, but I also was practicing nursing because I was responsible for what they learned and what they did and making sure that they learned it well. Following that, the position as a director of nursing became vacant, and I wanted to impact more students. As a faculty member, I worked with 12 to 24 students, but as the leader of the program, I would have the opportunity to impact over 300 plus students. And so I applied for the position, was selected, and became director of the nursing program at Florida Junior College, which then became Florida Community College in 1984. Did that for a period of time, and so then I moved into the next level of administration and became dean of the nursing program. Again, an opportunity to influence and make a difference for more students in terms of the kinds of faculty who were hired for the program, the kinds of facilities we provided, the kinds of experiences we provided. Enjoyed that tremendously, and went on to become the dean of all of the health programs at the college, and ultimately ended my career as president of the North Campus and the Nassau Center of Florida State College at Jacksonville, which again was an administrative role. So as you can see, I started as a nurse. I've never given up my license as a nurse. I've always taught. I've always kept my hands involved, and I promised, well actually I had my family promise that they were going to help me keep my license current even when I got old. I have to do the required continuing education units in terms of staying current, and I do that every 2 years to maintain my license. But nursing is a career that is needed because people go to the hospital because they need nursing care. If they could take care of themselves at home, they would be sent home, but nursing is an important part of the healthcare profession, and kudos to nurses.
We are all nurses, and we want you.